Everybody, thank you for attending this webinar today. So this is the first webinar in the Alabama Perinatal Quality Collaborative Summer Mini-Series on birth doulas. This specific webinar, Scope of Practice from Antepartum to Postpartum, will lay the foundation for who a doula is, what they do, and how their role fits into the birthing experience from prenatal care to the delivery room and into postpartum. Our speaker today, Susan Petrus, is the co-founder and executive director of BirthWell Partners, which was founded in 2011. BirthWell Partners is a nonprofit organization based in Birmingham, where they train community doulas and provide free and reduced cost doula support to under-resourced pregnant and postpartum individuals throughout the state. BirthWell also provides community outreach and education to prepare, educate, and empower parents during the labor and delivery experience. Susan is a certified birth doula, postpartum and infant care doula, lactation educator, and childbirth educator. Additionally, our obstetric quality improvement nurse, Amanda Doring, will discuss how the role of doula supports our current OB initiative, which is promoting vaginal births, or also known as the safe reduction of cesarean deliveries. So without further ado, Susan, you can take it away, and I will be monitoring the chat as we go. So if you have questions while Susan is talking, feel free to leave it in the chat, and I will make sure to get those questions answered as we go. And Susan, you are on mute.
Thank you. So thank you for coming today. As Naomi said, our topic is birth doulas, scope of practice from antepartum to postpartum, or in other words, doula care, what it is, what it isn't, and why it matters. And that's kind of the agenda for today's presentation. As she mentioned, I'm a birth doula and postpartum doula, Lamaze certified childbirth educator and lactation educator. I'm one of two co-founders. I see that Dahlia was also in the presentation. She's the other co-founder of BirthWell Partners. And our mission is two-pronged to provide birth doula services and to train doulas who are able to provide those services to families in Alabama. Our objectives for today, at the end of the presentation, participants should be able to describe 3 to 4 ways that doulas serve clients and in what time frame birth doulas are working with clients and postpartum doulas are working with clients. Identify 1 to 2 ways that doulas and midwives differ and how they could also be similar. Explain how doulas enhance patient care, and list 3 to 4 ways that doula support impacts maternal and infant health outcomes. So if you're not familiar with what a birth doula is, let's start with the definition. A birth doula is a person who's trained to provide informational, physical, and emotional support to pregnant people before, during, and after childbirth. So typically starting at some point during pregnancy. Doulas are also present during labor, and then birth doulas work with families in the early weeks. Okay. One of the most common misconceptions is that doulas and midwives are the same thing. My elevator pitch now starts with, okay, we're not midwives. So as you can see from this chart, we also have multiple types of midwives in the United States. So that also kind of confuses people. So birth doulas, the main difference between a doula and a midwife is doula is going to provide non-medical support, whereas a certified midwife, whether they're a professional midwife or a nurse midwife, is considered a medical care provider, and they're going to provide maternity care. The perinatal scope, as I mentioned, the birth doula is working with families prenatally, during labor, and early postpartum. That's going to be similar between doulas and midwives in that time frame when we're working. But midwives are also going to work with families on other parts of their reproductive health journeys. Settings, birth doulas can accompany families whether they're giving birth at a hospital or a home birth or a birth center birth. Certified professional midwives are going to be found in Alabama, at least at a home or birth center setting. And nurse midwives in Alabama are going to be at a hospital or birth center setting. As far as birth doula services, doulas meet with families prenatally. Different doulas packages will look different, but in general, doulas are going to meet a few times with families prenatally. Those visits could be at the client's home, most often probably at the client's home, honestly. They could be accompanying a client to their doctor's appointment, or they may choose another location, library, park, somewhere that's convenient for that client to meet. And typically those visits are going to last for an hour or more. And in between those visits, there'll be contact by phone, email, text, whatever the client's preference is for communicating with their doula for those check-ins. And when the client's in labor, the doula will be the most continuous presence that person typically has. Doctors and midwives and nurses are going to come in and out of the room, but the doula will typically stay there 12 plus hours, sometimes up to 2 days with the client continuously, whether that's the same doula or a backup doula comes in. So it is not uncommon for a doula to spend 12 or more hours with a client in labor. Okay. This chart is really helpful, I think, to identify the separation of those roles and also where they overlap. Of course, everybody who's a part of this care team wants a healthy mom and a healthy baby. So over on the left, you've got the medical members of the care team, midwives, OBs, and L&D nurses who are going to be responsible for the patient's medical needs. The midwife or OB is going to be making clinical recommendations, assisting with delivery. The nurse is going to be monitoring vital signs and administering medication. Excuse me. So like I said, they're going to be responsible for monitoring the mother and the baby's medical health. On the right side, you have the other support for the birthing person. So the doula supporting preferences, facilitating communication between the client and the care team, supporting the partner as well as the birthing person. The partner, who is the person who loves the mom best, and knows that birthing person best, is providing a lot of the emotional support and may also be providing a lot of physical support as well. Most of this presentation is focused on birth doulas, but just a few moments on terminology. There are many, many types of doulas. There's birth doulas, there's postpartum doulas. There are doulas who focus on fertility, doulas who focus on bereavement, and full spectrum doulas as well. You may also hear the term community doula, and that's going to be doulas who are specifically focused on serving underserved communities, and many of those doulas also come from those communities that they serve. Excuse me. You may also hear the term private doulas. And that term may be used for doulas to distinguish themselves from community doulas. So private doulas indicates the type of payer. The client is typically self-paying for those services. Other things to know about doulas is many doulas are not working full-time in birth work or as doulas. A lot of doulas will hold full or part-time jobs in other work, which may or may not be healthcare related. I know for BirthWell Partners, we've had doulas who've worked with us who were counselors, chefs, mathematicians, nurses, so a wide variety of people. A lot of people are not really sure about how one becomes a doula and what the certification requirements are or aren't. So most doulas do have some formal type of training. There are a number of organizations who offer these trainings. There are some organizations that are specific to the United States and some are more international in focus. And that process for certification is going to vary by organization. Now, certification is not a requirement for doulas to practice, and not all doulas are certified. Um, Dr. Amy Gilliland has been doing a lot of work in looking at competencies and skill sets for doulas. She just released a paper on this, and I know she's continuing to work on this, but she looked at doula skill development and said it is similar to the evolution of nurses in their skill development, although their skill set is obviously different from nurses. Okay. All of the different training organizations are going to have their own scope of practice and code of ethics, but there is a lot of overlap and similarities between them. Um, if you want to look at a few of them, there's links on this slide to DONA International's Code of Ethics and Standards of Practice, and as well as CAPA's. But like I said, most organizations are going to have these documents. So some of those core principles that they have is maintaining client confidentiality, being HIPAA compliant. It's super important that doulas are non-judgmental. Trust is a huge part of the doula-client relationship. And so being non-judgmental is incredibly important. I already mentioned that the type of support that the doula provides is going to be emotional, physical, and informational, and not medical. A lot of the work that a doula does, and that's codified in the scope of practice and code of ethics, is around encouraging informed decision-making by the client, supporting the client's choices, the client's preferences, and facilitating the communication between the client and their care team so that those preferences are heard and respected. Okay. What happens during a prenatal visit? In general, prenatal support might be 2 to 3 visits, each of those visits lasting over an hour, but there are doulas who do a lot more visits, and there are some doulas who may do just 1 to 2 visits with their clients prenatally. Care can be established at any point in the pregnancy. I know there are some doulas who want clients to wait until after the first trimester, and then there are a lot of doulas who feel like the earlier the better because that gives more opportunity to form the relationship before labor. So these visits are to find out where gaps in knowledge may exist and help clients to get the information that they need to fill those gaps. Find out what the client's other needs are. As far as community doula work, we know that some of our clients, their needs might be related to housing or transportation or food. And so the community doulas are also providing those referrals as well as referrals about childbirth and parenting. We help clients to understand their full range of options and help them to clarify what their preferences are so that they can communicate them in the form of a birth plan or verbally to their doctor during prenatal visits and to their doctor, midwife, or nurse during labor. A large piece of what doulas also do is to help clients to understand what their rights are as patients in the hospital and as maternity care patients. And that includes explaining some of the key concepts that they might encounter as they're researching information or having conversations with their providers. So, what is evidence-based care? What does it mean to give informed consent or to give informed refusal? How do I explain what I want and advocate for what I need? So we spend time on that prenatally. We also, we're helping them to prepare physically as well. So doula might be showing them some techniques to stretch, to relieve pregnancy discomforts, talking about positions for laboring, showing their partner or of other family support people comfort measures or techniques that they can be using in labor. And then beyond that, talking about what happens when you come home with the baby. What is your postpartum plan? Who's going to be taking care of your family? Who's going to be taking care of your pets while you're taking care of your new baby? How are y'all going to eat? So there's a lot of conversation that happens in helping people to think through what all of their options are and planning so that they can be as well supported as possible during this process. Okay. During labor, typically in early labor, the client is gonna to call the doula or text the doula, and have a conversation about, this is what's happening. I think I'm in labor. Um, what do I need to do? Do I need to go to the hospital? So the doula can't actually tell people what to do. We listen, we ask questions, we help them think through um, what they feel like they need in the moment to decide, like, when do I go to the hospital? Um, and then at whatever point the client wants the doula to join them, whether that's at home or in the hospital, then the doula will go and stay with them continuously from that time. And the doula is going to bring a calming presence, help the client to change positions, utilize those comfort measures, and provide the informational and decision-making support to help them to indicate what's most important to them as labor is unfolding. Okay. Doulas will typically stay a few hours after birth. I know in the case of a family that might have a baby that goes to the NICU or a client that's had a C-section, the doula may stay a few hours longer than that immediately post-birth. So the doula is going to be doing things like supporting the client to have skin-to-skin contact, to do that initial breastfeeding if that's their preference. They may be photographing the family. Everybody may be busy. The mom may have had a long labor, and the doula may be over there letting her know, you can have something to eat now. Would you like to eat something? Handing her a drink. There could be questions that the family has immediately after birth, especially if it's been a fast birth. Things have been unfolding really rapidly. So there can be a period of debriefing, answering questions. I know for me, a lot of times I'm also heavily supporting the partner at this time, encouraging the partner to ask questions or the partner to walk over to the warmer and talk to their baby if there's a moment of separation. And then having a doula present during those first hours after birth is another set of eyes on the client. Nurses are doing their jobs, coming in and out, but usually the doula is the one person who's just kind of sitting there observing the family and the baby together. So they're able to just be that other set of eyes. And of course, if a client is rehospitalized for some reason, the doula can return to the hospital and provide support to the family during that readmission. Okay. Beyond the day of birth, what a birth doula support looks like in the early weeks postpartum is checking in, calling, texting, every day, every few days, seeing how's it going, how are you feeling, how's breastfeeding going, are you having any issues with the baby or with your physical recovery? If we might be encouraging them to contact their provider if they're having any warning signs. Providing basic information about, yes, this is normal that newborns do this thing. They hiccup a lot, they sneeze a lot. Listening as they debrief and talk about the birth experience and provide emotional support, and making those referrals, whether they are, again, related to the birth and recovery, or whether they're related to other needs that the family may be having. Shifting focus just briefly now to postpartum doulas. So birth doulas will typically work with a family during pregnancy and up to maybe 4 to 6 weeks postpartum, whereas a postpartum doula is going to work with a family from the time of birth up to 1 year postpartum. So the goal of postpartum doula care is to really care for the birth giver, so that they can provide care for the baby and work on integrating the baby into the life of the family. So it's going to be helping with, again, with emotional support, physical support, assisting with information and demonstrating about newborn care. A lot of questions about sleep, a lot of questions about breastfeeding and feeding. And another thing that postpartum doulas are going to do is they are going to look at some of the needs that the family have that distract them from caring for their baby. So maybe some light housework, washing some bottles, washing some laundry for the baby, maybe providing some attention to other siblings so that that family can focus on the newborn and their healing and recovery. Okay. So let's talk a little bit about myths because we know there's lots of myths about what doulas do, what they don't do. So one of the most common myths is that doulas are for natural birth. Um, and as we know, natural birth can be lots of different things depending on how you define it. But I think most people think of natural birth as an unmedicated birth. But doulas support all kinds of birth. We support clients whether they're having a medicated birth, an unmedicated birth, spontaneous vaginal birth, induction, planned C-section, emergent C-section. We're really there to support whatever their needs are for whatever type of birth they're having. Another myth is that I don't need a doula because I have my mom or my partner or my mom and my partner there. So doulas don't really take the place of family support. We're an addition. So we can help your family support to be more effective. And some of what that looks like could be explaining things, making sure that the partner or the mother, whoever is there supporting, is also taking care of themselves. They need to eat, they need to drink, they also need to rest. We can demonstrate comfort measures so that they feel comfortable using or model support affirmations so that the partner has something to say, knows what to say, just to get them started. Another thing that we also find is the whole family wants to be there at the time of birth, whether they're in the room or in the waiting room. But then that family needs to go home and they need people who are available and able to take care of them once they're home. So the doula is somebody who could be there focused on them during labor so that their family members can be more fresh to come in and provide the support that they're going to need once they go home from the hospital. And often it just takes lots of hands. Partner is talking and hugging and loving on the birthing person, and the doula might be behind them rubbing on their back, and then they switch off. So it is very much a team effort. Another myth is that medical staff are enough support. And the truth is that doulas and medical staff are really fulfilling different roles. Because OBs and midwives and nurses have a medical role, there's a whole set of charting and documenting that they need to do that we don't necessarily have to do. And so we're able to put our entire focus on the birthing person and their family. But it's really great that people have a whole team to take care of them for all of their needs. So it's not a conflict. It should be a collaboration. Another myth is that doulas tell people what to do. And that is so absolutely out of scope for doulas to give advice. We do support people's decision-making and their rights of self-determination. And you want to think of doulas more as a megaphone or a microphone to amplify the voices of their clients or needs and preferences of our clients, but we absolutely should not be in the room speaking for the client because then we have just taken away their rights of self-determination and decision-making if we do that. Another myth, doulas deliver babies, and this goes back to doulas or midwives. So a lot of doulas don't even like this word deliver because who delivers the baby, right? Moms give birth to their babies. Midwives and OBs assist. They have that medical knowledge and that clinical training, and doulas are there to provide that non-clinical support. Okay. And lastly, doulas do nothing, as in this is a nurse or a doctor saying, I walked into the room and the doula was just sitting. So the truth is that the doula is there to support the client, but that support looks different for every client. And that support sometimes just includes presence. So if the doula is just sitting or standing out of the way when a care provider walks into the room, some of the things that they could be doing is in early labor especially, or with the client who has an epidural, they may just be making conversation to put the client at ease, because we know that if the client feels safe and relaxed, labor is going to progress. We might be respecting the client's desire to rest. If they have chosen to get an epidural, the first thing that they might need to do is to take a nap. So I don't want to be in her face talking to her or rubbing on her back or interfering in a way that's distracting. I want to support her need to rest. Maybe the doula has stepped out of the way to give the family member or partner an opportunity to provide support. This is the person or the people that are going to be supporting and having an ongoing relationship with the birth giver. So it's important for them to be able to provide support. And a lot of times doulas will kind of step back when the medical staff comes in, because we know that they've come in for a reason, to have a conversation or to do a vaginal exam, and they need to have the space to do that. So, and lastly, not all clients actually want hands-on physical touch. I know for me, when I was giving birth, I was so nauseated I couldn't stand to be touched, which was very against what I thought I would want. And I've also had clients that are just not comfortable with physical touch. They found it too distracting, or for other reasons, maybe they were just not comfortable with physical touch. Okay. And shifting gears, I want to conclude my portion of the presentation was looking at some of the evidence for doula support. And there has been quite a lot of it. I'm just chosen a few things. This comes from Obstetrics and Gynecology from 1996, so this is 20 years old, but it's still valid. Doulas do make a difference. They looked at the length of labor when someone was supported by a doula, and they looked at utilization of Pitocin and pain medication. And what they found was that even when patients had Pitocin and were more likely to have Pitocin use, that their length of labor was almost 3 hours shorter. So having a doula there decreased a person's labor, even though Pitocin was there. They were using Pitocin. People were less likely to perceive pain, and were less likely to use pain medication when a doula was present. They were also more likely to have increased satisfaction with their birth, increased bonding with their infant, and increased breastfeeding. So those are outcomes that would continue beyond the day of giving birth and are super important for infant health and for parenting. The Cochrane collaboration has conducted a meta-analysis more than once. They did it, I think, maybe the first time in 2013 or 2014, updated again in 2017. So they looked at lots and lots of research about doulas and collated studies. And what they concluded was that continuous labor support has clinically meaningful benefits for women and infants, but also importantly, no known harm. And they concluded that all women should have support throughout labor and birth. They were also able to, some of the studies included people who were doulas and some who were family support and other observers. And what they concluded from the studies was that this type of continuous support was most effective when the person was neither a family member nor a member of the hospital staff. So in other words, a birth doula. Okay. This is some very recent research that came out. We shared our data with Dr. Natalie Malak at University of Alabama in Huntsville, and she looked at over 42,000 Medicaid births in Jefferson County from 2012 to 23. And she looked at data from BirthWell Partners Community Doula Project from 2012 to 2023. And then she compared the outcomes for families who are similar with and without doula support. And she did two things. She looked at the significance. She looked at the impact on the outcomes and was able to show that it was clinically significant. And then she also was doing a cost analysis. So she was able to show that there was a cost savings associated with the outcomes. improvement in outcomes when there was doula support. So she was able to show that there was clinically significant improvement in a number of measures, including breastfeeding initiation and C-sections. And I know for the sake of our presentation today, we're concerned about C-sections. So there was an 18% reduction in C-sections when there was doula support. There was a 15% increase in breastfeeding initiation when there was a doula present. There was a 39% reduction in preterm birth and a 26% reduction in low birth weight births and a 64% reduction in very low birth weight births. So then utilizing that data, she was able to show that just for focusing on preterm birth, the cost savings per birth was approximately $2,600. And if you assume that the cost of doula care is roughly $1,500, then there's still a net savings of about $1,200 per birth. So if Medicaid were covering births for clients, that would be the net savings to Medicare for preterm births avoided. And so that actually concludes my part of the presentation. And Amanda is going to talk more about ALPQC and the doula's impact on some of the initiatives that y'all have going on.
Thanks, Susan. So I'm Amanda. I am the Quality Improvement RN over obstetric initiatives at ALPAC. For anyone that's not familiar with who we are, basically we're a team that partners with clinical care sites, public agencies, other community organizations to help improve maternal and infant outcomes in the state of Alabama. We want to optimize outcomes, reduce variations in care, and look at like evidence-based ways to do that. So you can move the slide, Susan. Our project right now for the OB initiatives, one of them is promoting vaginal births or safely reducing cesarean deliveries. What we're looking at primarily is reducing the rate of C-sections among first-time mothers. We're focusing on those deliveries because there's a wide variation of C-section rates among first-time mothers. So that kind of suggests that there's variations in practices rather than an inherent risk within that group of birthing people. So this diagram kind of shows like the overall goal and how we can get there. And then I have stuff on the side about how doulas assist with reaching this. So over on the left is our overall goal. We want to reduce the rate of primary C-sections by 20% by the end of this initiative next June. And then in the middle is kind of higher level focus areas to achieve this goal. Then next to that, we're breaking those down into smaller measurable chunks so that we can work on change ideas to achieve this goal. And the things that I have filled out within the diagram, it kind of just talks about how doulas can help with these different aims. So basically, just to summarize these, doulas are assisting patients in understanding their birth options and to create a birth plan. And then they're going to help patients share those preferences with the care team. They provide them education. And like Susan showed us, they support the reduction of C-section rates. They provide them with ways to coping mechanisms during early labor, potentially leading to fewer latent labor admissions. So patients are, staying at home longer while they're in that early labor period that can, sometimes take a while before they come to the hospital. And that's shown if before admitting the patient before 6 centimeters, that can kind of help reduce C-section rates. They're assisting the birth team with position changes that encourage labor progression. They're by assisting with those position changes, they can help correct fetal malposition, which can sometimes lead to fetal concerns during labor. They're helping with pain relief through touch, massage, counter pressure, those kind of physical elements. And then they're providing evidence-based information so that patients can make the best decision for them. Okay, we can go to the next one. And then those were kind of like the outcomes that we're looking at and how they can support that and like reducing the actual like quantitative data. This is more like how doulas can help support our structural measures. And the structural measures are kind of those processes in place on the unit that can help us in achieving these goals. So one of them that doulas can support is patient and support network support after an unexpected or traumatic C-section. So doulas can provide trauma-informed support to their clients through the use of clear communication, seeking consent in advance. They advocate for safety, trust, transparency. They promote choice and control. They can help communicate triggers to the clinical team. Sometimes the patient may not be mentally in an area where they can do that, so the doula can help be that voice for them. They can assist them in identifying any kind of emotional triggers to past traumas. They can acknowledge that trauma's impact. And then if they do have a C-section, they can connect the patients to support network specialized therapists that can help them in the aftermath of that, because it can be a difficult thing for people to go through if that's not what they were, expecting their birth to be like. You can go to the next one. This just kind of further breaks down that term coping mechanisms. I know that gets thrown around a lot, but sometimes there's not a big explanation of that. So basically, doulas promote and educate clients on these coping mechanisms that focus on physical, emotional, and mental needs. I'm not an expert in these, but Susan touched on some of these things that doulas do. So they can help with nervous system regulation through, breathing exercises. They can help with like the sensory management by making sure the lights are low in the room. It's a calming environment. No one's speaking incredibly loud. They can encourage tactile anchoring, basically helping them like get back into what's going on if they're getting in their head through, encouraging the partner to touch the patient. And be a calming presence, make sure they're always obtaining consent. Weighted blankets are a part of that. I've seen patients use those during their labor to kind of help with those sensory needs. And then they can just help with emotional regrounding by helping kind of reframe what's going on, pausing, and they can also use affirmations to help them with that emotional regrounding. We can go to the next one. This talks about how doulas can help with labor management huddles. So one of the ideas is that everyone should be involved in this process and the shared decision-making during a patient's labor. So that includes the clinical care team, the patient, their support system, families, anesthesia, and the doulas. So ways that doulas can be present in this is by they can provide updates to the providers about the patient's comfort level. They can educate the patients on understanding kind of complex medical terms into easier to understand language. They'll, support and advocate for the patient's birth preferences, and they can encourage the patient to voice those birth preferences and help them make decisions alongside the clinical team. Good. Is there another slide? The next one, if there is. Okay. And I think this is the last point, but ways to kind of integrate doula support. Hospitals have policies for basically everything. So this talks about how hospitals can address policies and procedures for doula support to ensure that patients are able to utilize this valuable support while also addressing scope of practice. So these policies should be based on evidence-based guidelines, basically the stuff that Susan was talking about. about how doulas do support reducing C-section rates and the benefits of having a doula in birth. They should address scope of practice and their roles, but they also should promote teamwork and mutual respect among everyone because we all have a role in this birthing process and everyone's important. And then they can discuss appropriate labor and postpartum support. And I'll turn it back over to Susan so that she can conclude the webinar.
Um, thanks for attending. And I think now we'll probably just open it up to questions, and I'm going to stop sharing the screen.
Yes, feel free to come off mute, or you can put your question in the chat and we'll answer that.
I'm curious if anybody on this call has any myths that we didn't touch on. Surprised we hit them all. Holly.
Hey, Susan, can you hear me?
Yeah.
Thank you to Susan and Amanda for a lovely presentation. I think one of the myths that I have heard in this work also is that there seems to be an assumption that many doulas are not trained to do what they do and or that they are just undereducated writ large. And I appreciate you didn't directly address this in your myths, but one of the things that you did point out is the broad level of I mean, because doulas aren't able to be doulas full time, they are often have other professions and other skills and, bachelor's degrees and beyond. And so I just appreciate you bringing that to light and recognizing that the majority of our doula workforce is highly skilled and highly trained from a broader perspective. So thank you for doing that.
Yeah. And I'll also add that I think among doulas, there tend to be kind of specialties is the right word. I know for me, I'm like particularly interested in prenatal physical preparation and techniques and positions to use during labor, especially to kind of troubleshoot any difficulties that might come up with the baby's position. That's kind of what I geek out over. But there are doulas who maybe don't focus on that so much, but they focus more on emotional support. And like I said, we have a lot of people who have come from counseling and social work, and they really excel at those kinds of skills. So there's there even within doulas, there tend to be things that we can kind of specialize on even within birth doula work. Are there any other questions or comments? I know I'm looking forward to the next webinar that you guys are doing in the series, the one in August.
We have a question in the chat from Dahlia. The Malik paper showed a decrease in PTB. Can you speculate as to how doulas impact that?
Yeah, so I think it could be a number of different ways. It could be the information provided encouraging people to go see their care provider if they're having warning signs, discussing what the warning signs are. I know we have handouts and resources that we use for our clients at BirthWell Partners encouraging them to contact their provider if they're having signs. It could also be some stress reduction. So it could be a number of different things, number of different factors.
Yeah, I can also reiterate the point that Susan just made about providing the education. The more times that the patient gets the education, the better. Just kind of reinforcing those warning signs of when to seek care. So, sometimes you go into a doctor's office and they tell you something and you forget about it, you blank. So, just making sure that we're continuously providing that education is so important, and doulas do a very good job at educating their clients about that. So definitely think that probably has influence on those decreased rates.
All right. Well, if there are no more questions, we can conclude today's webinar. So thank you, Susan, for sharing your expertise and knowledge with us today. And Amanda, thank you for letting us know how doulas can support the ALPAC's initiatives. So you can find a recording of today's webinar on our ALPAC website. So I believe Britta put in the link earlier, but I'll just throw it in now as well. And then you will also receive a follow-up email with an evaluation form for this webinar. So you can just let us know how it went. And then you can also enter your information to receive continuing education credits. And we'd also ask that you share this webinar and the recording with your network, and also let people know what you learned today so we can all collectively dispel the myths that are out there about doulas. And like Susan mentioned, there's another webinar that will be taking place. It's titled Building an Integrated Birthing Team. So that's going to take place on Wednesday, August 5th at 12 p.m. I will throw in the link to register for that. But that's going to be another great webinar. It's kind of building off of this, but it will bring together a multidisciplinary group of healthcare professionals. So a physician, a nurse, we'll have a few doulas, and then a certified professional midwife, and they'll explore together how they can create a collaborative birthing team that benefits the patient with the goal of providing a safe and comfortable, positive environment through labor, delivery, and after. So you can use that link in the chat there. And then I'm also going to include the link to the BirthWell Partners, just so you can explore their website further if you'd like to learn more about what they do and get involved with them. So thank you everybody for attending. And again, look out for this webinar posted in a follow-up email as well. And if there's no other questions, you are free to go for your afternoon. Feel free to email me if anything else comes up, but thank you again for attending.